Hi, everyone. I'm Dr. Krista Burris.
And I'm Dr. Michael Kim.
And we're here with Coachella Valley Direct Primary Care. And today is May 26th, I think.
Yes.
Yes, 2021. And we're talking about the Coachella Valley specifically in regards to coronavirus.
Well, how are you doing today?
You know, we've had kind of an interesting week, I have to tell you.
Yeah.
Yesterday, I got a flat tire coming home from work. And not just like a nail, but like a slash. And I was on a busy street, so I ended up having to ruin the sidewall of the tire to get to the edge. So there was that.
And then the battery in the car died as I was going to pick up lunch for our kids.
Today.
So I dealt with that.
Yeah, so AAA, by the way, this is a helpful tip. If you haven't been driving much and you've been starting to get back out there, make sure your AAA is paid up because we needed it twice in 2 days.
Yeah. So.
Yeah.
But I guess just life is getting back to.
Yeah, one of our kids flooded the bathroom this week too.
Yeah.
So it's been an eventful week, and hoping your week is better and that we're done with events for a while. Yeah. Okay.
Well, do you want to get into the numbers?
Yeah, absolutely. So overall, the numbers for our District 4, which is the Coachella Valley, this is for the entire week. So this is the week ending May 23rd, which was Monday. And what you'll see here is that our cases in the Coachella Valley are quite low at 72 for the week, but we still had 3 deaths. And we'll probably be seeing this on an ongoing basis, that even though our caseload is low, we're still continuing to see deaths. And I think this is important for people to realize. Even though we have low numbers and that we are having our increased vaccination rates, we still do have a large portion of our population that's unprotected by vaccine. And the coronavirus isn't changed. It's the same disease, and we still don't have any magical cures for it. So if people do get coronavirus, we still have the same armamentarium that we had back in the middle of the winter. So it still is a dangerous virus. And even though overall things are really looking good, I still want people to remember just to be respectful of what this virus can do and treat it as such. If we go down to the bottom, you'll see that our positivity rate this week is down to 1.4. And our ICU census is now 0. However, I'm happy nobody's in the ICU, but remember that sometimes those numbers go down because people have passed away. So I'm hoping they don't go back up, and we'll start to see our hospital numbers continue to drop. Our positivity rates are about the same as the counties this week at 1.4, and I believe the county's overall case rate is at 2.5. So again, we're still in the orange tier officially, and I don't think that's going to change before June 15th when the tier system goes away. So let's go to our next slide. This is going to be the daily report for the county.
Right.
Okay, so for the county, what you see here is this is May 26th, so this is today. This has been a good day in the county in that there were no new deaths and only 74 cases. So not bad, honestly. And then if we go down to the bottom, or down a bit, we'll see that our positivity rate has been sitting at 1.6, which is actually up from last week. So we have a slight trend upward, but overall it's stable at that 1.6, so I'm not too worried about that. So that's not bad overall. And let's go to this next slide. What you'll see here is this is a dashboard for the Riverside County vaccination numbers. And this is a really nice, just bird's eye view of where we are as a county. We have actually administered more doses than we received. And we're almost at 2 million doses given in Riverside County. What this means is that the vaccine doses administered counts all the vaccines that were given by both federal sites and county sites, but vaccine doses received only count the county site vaccines received. So you'll see this puts a federal contribution at about 685,000 doses. That's just, these are big numbers, and this is great. Okay. And if you look at our Riverside County residents 12 and up, we've got 816,000 people who are fully vaccinated and about 1 million people who are at least partially vaccinated or fully vaccinated. And that's great. We've got about half of our population in Riverside County now at least partially vaccinated. And the question is, where do we go from here as a county, and what is going to happen locally? And what we've seen is that the big sites are gearing down. These are the big sites like the convention centers, even some of the big hospital sites. Probably what you'll see is over the summer, those sites either limit their hours or maybe close some days of the week. We'll see how they decide to move forward, but we're probably going to see a shift to smaller clinics that are more accessible in smaller places. So we've seen that already this week with some of the vaccine clinics that are being held at local schools. And some of the, there's one out in Coachella, I believe, at a legal center. So the shift now is more into the community rather than putting it at a big site and expecting everyone to come to it. So I think this is a good shift. It's time for it. And I think we'll see a slower rate of vaccination, but we still should see continued improvement in these numbers. So that is our vaccination. And that's it for slides for today. I do have something I want to talk about. I don't know, did you see anything about the reports from the CDC on myocarditis in teenagers with their second vaccine?
I saw a little bit of that. Yeah.
So that's what I wanted to talk about a little bit, because people may hear that and may be concerned. So what happened is anytime they're rolling out a new vaccine, especially in the first couple of years it's being used, they monitor very closely any sort of adverse event. So it doesn't even matter what it is. If something bad happens to you in the first month or so after you've had a vaccine that's new, it's going to get reported and tracked. And the reason for this is so that they can capture any adverse reactions to a vaccine that are happening in a very small number of people. That is our tracking system. It's actually working great. But what they decided to do is they'd seen a few reports of children having episodes of what's called myocarditis or inflammation in the heart a few days after their second dose. And so it's not happening at a rate that's higher than myocarditis happens in this population anyways. So myocarditis happens in about 10 out of every 100,000 kids of this age group. That's 10 out of every 100,000. We've now given 600,000 vaccines in the 12 to 17 age group in the United States. And they found some reports of myocarditis, but it wasn't more than the expected 60 per this population. So The question is this just random and they happen to have it at that time and there was another cause? Is it from the vaccine? They want to answer that question, so they decided to make this information public so that doctors could be on the lookout for it and capture it and find it if it is happening. But because it's not happening at a rate that's higher than expected in this age group, in this population size, there's no clear evidence at this point that the vaccine has anything to do with it. So because of that, it can create some confusion. And I feel like this is the last thing we need right now is people getting something more to be confused or scared about or nervous about. But honestly, our child is due for a second shot coming up in another week, and I have no qualms about getting it. And they're in that age group. But for me, it's just the rate of the myocarditis that's being seen isn't high enough for it to increase my concern at this point. But it is something people may hear about in the media.
Right.
Yeah.
I think the other thing they wanted to talk about is I kind of feel like right now people are living in kind of two parallel universes. By that I mean, if you're vaccinated fully, your risk is pretty low of catching COVID, and even if you get it, you're going to get a mild case. And even if you get a mild case, you're probably not going to spread COVID to many people. And so that's kind of one parallel universe. And so, the CDC says you don't have to mask anymore unless certain situations occur. And then you have people who can't get vaccinated for either age or their medical status, or don't want to get vaccinated. And they live in a different universe where they're supposed to be social distancing, and they still have the same risk of catching COVID as if it were the beginning of the pandemic. That hasn't changed, right? The amount of COVID out there has changed, but the risk of getting it hasn't. So it just seems like it's this bizarre.
Yeah, we're in this weird transitional phase. I feel like for a lot of people, they want to skip to the end where COVID is something you don't have to think about at all. And if you're vaccinated, you've kind of been given the green light to sort of behave that way. And yet, still remembering that there are people around that aren't vaccinated. And the vaccine is not 100% effective in my age group at preventing all COVID. So I could still get a mild case. I'm not likely to end up in the hospital, right. But if I got a mild case, that's really going to be a problem for my work. So there are still reasons that I would prefer not to get COVID. Right. And because of that, I might still think twice before eating at an indoor restaurant, even though I'm vaccinated, because I just don't want to take that 5% chance that I'm going to have to miss a couple of weeks of work. That to me would be more than a little problematic, and not being able to be around my unvaccinated children.
Right. But if you walk into a place, you're better covered being vaccinated than not vaccinated.
Right. So I feel like the chance of that is really low, but it's not zero. No. So I'm still avoiding super the highest risk environments. I'm still preferring to do things that are in a lower risk way, if I can.
I went to a mid-morning movie with a friend of mine who was vaccinated, and there wasn't maybe other two people in the theater. So, I felt comfortable doing that. Now, the movie was horrible. But
yeah, the movie was bad. Did you wear a mask?
Into the theater, yeah, but not while we were watching because I had popcorn and a drink.
So that must have felt pretty normal.
It did and it didn't. I think if I had seen a better movie, maybe it would have been better. But
beggars can't be choosers.
No, there's not a lot of good movies out there right now. So, but yeah, so it just is this interesting. It feels like the pandemic's over, and it is for the most part for some group, but it's not for other groups in terms of the unvaccinated, because again, it feels like you should be able to go around, but you really can't, because it's still, you're seeing the positives at the urgent care, and we're seeing some here every now and then. So
yeah, that was sort of a wake up call. There were a couple weeks where we didn't see any positives at all, and then suddenly we just started seeing a handful again, and they have been pretty constant.
Yeah.
So we're definitely seeing it circulating still. It's just we're not seeing the people getting as ill as often,
Right.
which is encouraging. There is a little bit of concern that in some of the other countries, in Europe specifically, the age of the people who are being hospitalized has dropped dramatically. And now it's mostly people in their 30s and 40s. So although they may not die, they're sick enough to be hospitalized and sometimes in the ICU. And that also would be better to be prevented.
Right.
So I think really sort of moving that vaccine push into that younger age group and explaining why, even though you're not likely to die, you can still get pretty sick, and the vaccine's safe and effective, can avoid it. Yeah.
And then my end goal would be is to get it to where at least the level of the flu was, right?
Mhm.
So if the COVID virus could be at the level of the flu, meaning that it won't hurt most people, but still people are going to get sick and die from it. But it's not this brand new thing. Then I think we've done the job. I don't think we're ever going to get to the herd immunity or the
herd immunity would basically mean it disappeared.
Right.
And I agree. I don't think we're going to get there, but I do think it can become
Right.
more of a nuisance rather
Right.
than such a huge threat.
So I think that's it, because we want to do our next show. So if you can hop on to the next show, Your Personal Health, where we talk about a little bit more about the just general health of Coachella Valley. We'd love to see you. And we will see you next week in June. I can't believe it's June.
What?
To talk about the COVID update. Thanks for joining us, and we'll see you next week.